It is an informational booth about the American Legion 1919 Society. I recommend you visit the booth during breaks when you get the chance. It will be here throughout the convention. You can see why so many generous donors strongly believe that our Veterans and Children's Foundation is a program worth supporting. Nominated by President Biden, our next guest was confirmed by the Senate and sworn in as 11th Secretary of Veterans Affairs on February 9, 2021. He previously served as White House Chief of Staff for President Obama. During the confirmation hearings for his current position, he said, "There is no more sacred obligation nor noble undertaking than to uphold our promises to our veterans, whether they come home decades ago or days ago." His leadership and advocacy were important factors in the passage and enactment of the Sergeant First Class Heath Robinson Honoring Our Pact Act, which indeed enables VA and our country to uphold the promises made to veterans. Please give a warm welcome to the Honorable Secretary of Veterans Affairs, Denis R. McDonough.
Well, good morning, and thank you so much, Jim, for that kind introduction, for your unwavering leadership of the American Legion. I want to just take a minute before we start to say a word about Idalia, that storm which appears to be strengthening even more as it approaches the Gulf Coast in Florida. And I just ask you to communicate with your fellow vets in Florida to please listen to our local authorities. Our team is working overtime to make sure that all of our vets in the Bay Pines facility are taken care of, moved to safer ground, and any of our vets who are worried about listening to local authorities and leaving, rest assured that your VA benefits will travel with you. We're working overtime to make sure that pharmacy contracting is available to you no matter where you are, that the clinical contact center for urgent medical care is stood up and ready for you. So please communicate to our vets to take this looming storm very seriously. We have no more important partner in our effort at VA than you and your team here at the Legion. Every single day, I see the real impact of your work, of your devotion to veterans, and of your partnership with all of us at VA. Let me just acknowledge some of the many great partners at the Legion who are deserving of our gratitude. Shannon, of course, your fantastic executive director. Dan, celebrating his 15th year as your national adjutant. The Legion's incredible service officers who have been working tirelessly to support the influx of vets filing PACT Act claims. And of course, all the Legionnaires, it's great to be here with you today and to see you gathered to undertake this really important work. I want to just say real quickly about one of the other leaders on the stage here, Senator Thom Tillis, a fierce advocate for veterans. And as the senator from North Carolina, also happens to be the senator of our fastest growing state for veterans. So he is exactly the kind of fierce advocate that veterans here need and for whom he does so much. Now, last year up in Milwaukee, we talked about the promise our country makes to honor your service and your sacrifice. I promised you that this year, 2023, would be a year of executing on some of our most important priorities. And together with the Legion, I'm proud to say that we're fighting and delivering for vets. Since the president took office and with the Legion's support, we've delivered more care and more benefits to more veterans than at any time in our nation's history. And look, all that work adds up to the only statistic that matters: veterans' lives saved or veterans' lives improved by the work we do together. So let me give you a couple updates on that work I promised when we got together last year. First, we're fighting to end veterans' homelessness. I told you last year our ambitious goal was to permanently house 38,000 homeless veterans. We exceeded that, having permanently housed 40,401 veterans. We're doubling down on that goal this year. And halfway through the year, we have data through June, we are on track again to exceed 38,000 homeless veterans permanently housed. Second, we're fighting to prevent veteran suicide. At last year's convention, I discussed how the rollout of 988 Press 1, the brand new National Suicide Prevention lifeline that connects vets quickly and directly to the Vet Crisis Line. Since that launch, the hotline has fielded over 1 million calls, texts, and messages, with an average time to answer of just under 10 seconds. Every second counts in a time of crisis, so vets are getting the help they need when they need it most. Third, we're fighting to get vets timely access to world-class care. In the past year, vets have had over 73 million outpatient visits at VA and 37 million more outpatient appointments with community providers. Meanwhile, we've seen a staggering 3,000% increase in virtual home visits since 2020. Nearly 28 million total such visits in that time. Offering care that is more convenient to veterans, be that at VA, in the community, or via telehealth, alongside focused processing technology changes, has led to improved average wait times at nearly 60% of our facilities. Fourth, we're fighting to deliver for toxic-exposed vets. We recently marked the one-year anniversary of President Biden's historic toxic exposure law, the PACT Act. This can be the largest expansion of VA healthcare benefits and direct benefits in decades. In fact, since the PACT Act was signed last August, veterans and survivors have filed over 2 million claims. Over 950,000 of those claims have been filed for toxic exposure-related benefits under the PACT Act. Over 4 million veterans have received toxic exposure screenings, and VA has awarded $2 billion in earned benefits to vets, their families, and importantly, to survivors for claims filed under the PACT Act. This new law, that would not have been passed without the American Legion's support, has the potential to help deliver care and benefits to millions of toxic exposed veterans and their survivors, including many of you here today. And that brings me to my fifth and final point. We're fighting to hire at an unprecedented rate. None of this happens from ending veteran homelessness, to ending veteran suicide, to delivering toxic exposure benefits. None of it happens without growing the size of the VA workforce. So this year of execution has also been a year of hiring. Hiring faster and more competitively while retaining the great workforce that we have. In fact, we're hiring at a record pace, having grown the VBA workforce by 18% and the VHA workforce by 5%, the highest levels in the past 2 decades, in spite of nationwide labor and healthcare shortages. Because people want to work for our nation's heroes. People want to work for you. In short, this has been a year of execution, but the execution isn't because of me. It's because of you, and it's because of the 450,000 VA employees in your communities, your neighborhoods across the country who keep veterans at the heart of their care. People like my colleague, Julie Patton. Julie, are you there?
Good morning. I'm Julie Patton. I work for the VBA Winston-Salem Regional Office. I've been with the VA for 26 years. While I'm not a veteran myself, the mission is very personal to me. My grandfather was a World War II veteran. He was badly wounded when his ship was hit by a kamikaze. My uncle was a POW in the Korean War. These special men in my life never reached out to the VA for help when they were discharged. They lived with debilitating illnesses and injuries the rest of their life. It has been my mission during my career to reach and serve as many veterans as possible. I never forget that each and every claim application represents a person and their family, people like my grandfather and my uncle. And I'm so eternally grateful to work with our American Legion colleagues because I know how deeply you care for veterans too. So we are leaning forward, working hard, and processing claims in record numbers. The Winston-Salem Regional Office did more outreach last fiscal year than any other office in the country. Just 4 years ago, only 25% of veterans in North Carolina were receiving VA benefits. That's up to 40%, and we are working each day to increase that percentage until every single veteran receives the benefits and care they earned and deserve. One veteran here in North Carolina comes to mind. I'll call him Rich. Rich has one of the most unique stories. He served in the Navy, Navy Reserves, Air Force, and the Air National Guard. Rich deployed to Southwest Asia 7 times over the course of his 35-year career. 35 years, 7 deployments, 2 different branches, 2 different reserve components. Rich was a member of air search and rescue units, saving the lives of his fellow sailors and airmen. And while he was doing that for us, Rich was being exposed, like so many of his fellow service members, to toxins. Rich remembers seeing the ground change colors as different toxins seeped across the topsoil from the burned pits nearby. Because of that toxic exposure, Rich developed sinus problems, including sinusitis, which is now a presumptive condition covered by the PACT Act. And while we all hope that Rich's health gets better with treatment, he's so grateful his condition is now service-connected. For Rich, the retroactive and monthly toxic exposure benefits are both a big step financially and a blessing. Even more than that, it's what this country owes Rich, what he's earned and what he deserves, for so courageously serving and sacrificing for this country for all of us. And when it comes to veterans like Rich, our commitment at VA is to fight for them, to fight for all of you. There are thousands of veterans out there just like Rich, and it means so much to serve them as well as they have served the rest of us. Thank you so much for having me, and I'm going to pass it to my colleague, Jan.
Good morning, and may I say, wow, I cannot believe this assembly. I am honored and humbled by this group of folks here, and I want to introduce myself. My name is Jan Pickett. I'm a nurse practitioner and I work at the South Charlotte VA in the same-day access. I'm a retired Air Force veteran and have served most of my career right here in the 156 Air Medical Evacuation Squadron in Charlotte. My last 2 years in the Air Force Reserves was as the IMA to the chief nurse at Shepherd Air Force Base. I come from a legacy military family. My father, who passed when I was 25, was a retired Army Master Sergeant. My brother is a Navy veteran, and my husband is a retired State Command Chief for the North Carolina Air National Guard. I've been in the medical profession for 40 years and just joined the VA about a year ago. I have worked in many medical systems, and I am proud to say that the VA is hands down the very best place for veterans to receive medical care. As a provider, I'm routinely amazed at the benefits and the breadth of services that we provide. The VA is constantly adding new benefits and services to our veterans. And I work in the same-day access clinic, Onslow Beach. My clinic is a full-access walk-in clinic, and we service all veterans, all comers. We are able to provide urgent and immediate care for veterans, including lab work, medications, refills, imaging, referrals, and we also upstairs have a walk-in mental health facility. We serve as a stopgap for veterans while they're waiting for an initial appointment with the veteran provider that will see them and be their primary care provider, and also for veterans where providers are not available to see them as quickly as they need to. And we also service our traveling vets, which may be coming into play soon with Italia. There is no medical system in this country that is better equipped and provides the same level of care for our veterans, and I am so thankful and privileged to be serving my fellow brothers and sisters in arms to care for our veterans. Let me tell you a little story about my brother, Jim. My brother refused to get care at the VA medical system for years. He has several medical conditions that are fairly severe, and he was skeptical. He just wasn't sure because there was negative press, and back in the day there were issues with the VA system. So after much cajoling and the rising costs of medical care, he finally agreed to give the VA a chance. And I will say that he is so happy with his medical care here. He feels that he gets better care at the VA than he ever did in the community. And let me be clear, he received excellent care in the community, but he is no longer a skeptic, and I'm so proud that he chooses the VA, and I am proud of his service to our country. The PACT Act has brought historic opportunities for the VA to reach out to veterans and those around the country, and based on this assembly, around the world, in fact, to communities big and small, and to veterans like me, my husband, my brother, and you. So I would say that the PACT Act allows us to focus holistically on veteran care, helping veterans and their families to deal with not only their toxic exposure issues, but also other medical conditions that, frankly, come away in our life. So many of these veterans are seeing the VA for the first time, and it gives us an opportunity to show them that we care for them as people first, and we are there to help them any way that we can. To my fellow veterans in this audience, I want to thank you for serving our great country. I am proud to have served beside you in uniform for 24 years and to work with some of the best people I know and best providers in the VA system now. God bless you, and God bless America.
My name is Elizabeth Whittington. Caring for veterans is especially meaningful for me because both of my grandfathers served in World War II. And I have a close cousin who is serving on active duty in the Navy today. I am fortunate to interact with veterans as neighbors, friends, and colleagues. I am so grateful to serve the best people I know and love, our country's veterans. It's an honor to give back to the men and women who have sacrificed for our safety and to serve them every bit as well as they have served us. The PACT Act has helped veterans in my community receive much-needed VA health care services. Too often, we discover that veterans have other important needs, such as stable housing and mental health care. Helping veterans with these basic needs allows them to focus more on what matters most, so they are able to live healthier and happier lives. My team works with veterans who are in need of home-based care or community nursing home services. Our goal is to meet veterans where they are and help them achieve what is most important to them. For many, that is being able to stay in their own home for as long as possible. For others, it's living in a setting with fellow veterans where they receive nursing services around the clock. I vividly remember a Vietnam-era veteran, I'll call him Steve, that we were able to help. Steve wasn't enrolled in VA health care and had received a terminal diagnosis with only weeks left to live. His family called, devastated and fearful of what was to come, but someone in the community told them to call our department because they knew we would help. We immediately connected Steve's family to the eligibility and enrollment office to expedite his enrollment and connected them to a VA hospice provider so home hospice services could be ordered. Meanwhile, other team members worked to set up home health aid services to help his family care for Steve at home. His symptom management needs later became too difficult to manage in the home setting, and Steve was able to transfer to Liberty Lane Hospice House at the Salisbury VA, where he received around-the-clock care by specially trained staff to ensure that his physical, emotional, and spiritual needs were met. His family was cared for by this same team. This allowed his family to be present with their veteran and savor their final days together. There are thousands of veterans out there like Steve, and it means so much to serve them as well as they have served the rest of us. Now I'll hand the microphone back to Secretary McDonough.
Elizabeth, thank you so much. Now you see, I agree with that. Now you see why I'm so excited to be part of this team. They represent the very best workforce in the federal government, the most passionate, highest performing public servants in the country. People who want to make a real difference in the lives of veterans. And I'm blessed to call each of them my colleagues. And you heard them. They each share the same deep devotion to serving veterans that characterizes all of VA's employees. People like Mark Belos, who leads VA's Winston-Salem regional office that you heard about a minute ago. Julie said it, but it's worth saying again. Mark's team has done more outreach to veterans over the past year than any other office in the country. His intensive, data-driven approach has dramatically expanded the number of vets applying for benefits across this state. And his team will not rest until every single vet in North Carolina receives the benefits and the care they've earned and so richly deserve. Now, the reason I come to this convention every year is to hold myself and all of VA accountable to you. So if you hear that we're not living up to these highest ideals, The ideals exemplified here in North Carolina by Julie, Jan, Elizabeth, and Mark, I want you to let me know. Shannon, your executive director in Washington, D.C., will surely let me know. Because America's vets deserve our very best and will never settle for anything less. So with that, let me close with a final request. To each of you vets, I ask, please, apply for your toxic exposure benefits now. Right now. There's no deadline to apply for the PACT Act. It's here to stay. Let me say this again. You can sign up for VA benefits, including the PACT Act, at any time. And thanks to the PACT Act, many vets are now able to enroll directly in VA healthcare without first applying for VA benefits or establishing a service-connected disability. Now, I just want to say to all of you, if you're a post-9/11 vet who deployed to a combat zone, you need to enroll directly in VA healthcare right now. There's a special enrollment period. If you left active duty before October 1st, 2013, you have until September 30th this year to apply. So if that's you, if you discharged between 9/11, 2001 and October 1st, 2013, please get your application in. And if it's your buddy who discharged in that period, please tell them to get their application in. Don't wait, because VA is the best, most affordable health care in America for veterans. And this is a new chance to sign up. Even if you don't need care today, you might need it tomorrow, or the next day, or 30 years from now, like Jan's brother. All you have to do is enroll, then you have access to VA care for the rest of your life. So apply today. I promise we will fight like hell to get you the care and the benefits that you deserve. Now, listen, there are people out there who will try to convince veterans that you need to pay somebody to apply for your VA benefits. That's just not true. Do not pay anybody to file your initial claim with the VA. Working with us or working with the incredible team here at the Legion, it's free and it's easy to apply. In fact, we have a claims clinic at this conference, so please stop by and meet with VA claims representatives who will help you file a PACT Act claim and answer any of your questions. And we need your help getting the word out. Please reach out to every vet you know. Reach out to your old Vietnam battle buddies with hypertension. Anyone who may have been exposed to Agent Orange. Reach out to every trooper you know who fought in Central Command over those 30 years of war. Members of the 1st Division in Saudi Arabia in August of 1990, and one of the last divisions to leave Afghanistan over 30 years later. Can I get an all the way from any of the 82nd Airborne paratroopers in the audience? Any of the brave soldiers, sailors, airmen, Marines who have served in the many years in between in those 30 years of war. We want you to file a claim. We want you to reach out to your brothers, your sisters, your parents, your neighbors, your sons, your daughters. Have every vet you know get a toxic exposure screening, file a toxic exposure claim, and sign up for VA health care. We need every single person in this room to help communicate with veterans and families and survivors to get the benefits that they've earned and so richly deserve. We just can't rest until we do. And with your help, we're going to keep our sacred promise to those who served and sacrificed, to serve all veterans, as well as each of you has served us. God bless you all. God bless our nation's service members, our veterans, their families, caregivers, and survivors. Thank you so much.